Can a deep plane facelift address facial asymmetry? I'm Dr. Delaney, and this was a question that a patient posed to me today during the facelift consult. And I just want to comment a little bit further about it. Uh, Most people, after their face is fully developed, after puberty, will most likely have some degree of asymmetry. You know, it's a wonder we're as symmetrical as we are to start. What I typically see to varying degrees is usually there's one side of the face that's a little bit longer, one side of the face that's a little bit more narrow. Um, and this asymmetry when we're young is not really noticeable. And the reason is all the tissue is high, it's volumized, and you're youthful. And when you're youthful, everything looks good. You don't really think about it. Now, when we get older and things start to sag, what we see is not symmetrical sagging. And the reason for that is the face is not symmetrical. So the side of the face that is more narrow typically will sag more or sag first. And the reason for that is our tissue is distributed over our cheekbones, our skeleton, our jaw. So the side that's more narrow will provide less support, and that's the side that's going to droop first. So as we age, this asymmetry is exaggerated, and then we notice the asymmetry. So to answer the question is, with a deep plane facelift, no, we can't address the asymmetry because oftentimes it begins with a skeletal issue. The underlying skull is asymmetric, and the overlying skin and muscle and fat pads, everything from the foundation of the skull up is asymmetrical. Will we pull harder on the lower side? No, because we don't want to create a tight or unnatural look on the lower side. But I'll tell you what we do is we release everything, we lift it naturally. Generally, what I see is the side that has sagged more, I'm usually able to lift it a little bit more and remove a little bit more skin. But I certainly don't compensate or pull harder on the lower side. At the end of the surgery, we want our patients to look natural and rested, not pulled or even more asymmetric. You're going to look refreshed, and you're going to age from that point in time, and your more narrow side is going to age faster. That's just how it is. And so truly the only definitive way to really, and this is even a perfect solution to really improve facial asymmetry, is to undergo double jaw surgery or surgery to reshape or reorganize the bone around our orbit. And the reality is that is way too invasive, and most people probably won't consider that as a viable option. So deep plane facelift can help lift and refresh your face, but if you have pre-existing asymmetries, they may be less noticeable when we lift the tissue up, but the surgery itself doesn't change underlying facial bony asymmetries.